Philippines and the Filipino hospital. To the average Australian, going to the hospital is a bit of a last resort. I'm not talking about turning up at the accident and emergency when you slice your finger open and it's 3 a.m. I'm talking about an illness leading to you being admitted for something. Now, how often does that happen to the average person? The average Australian, I mean by that. Now, I'm going to take a punt and say not that often. I know for myself that it's a pretty unusual thing, and same for most of my friends and relatives over many, many decades of life in Australia. Except for accidents and having babies, most of us don't turn up there very often at all. Me? Tonsils and adenoids out when I was 10 years old, as was fairly common back then for just about everything. They ripped out the tonsils. A couple of nights in the outpatients 15 years ago when I had a couple of bouts with kidney stones. And that's it for me. And my kids, never. Apart from a few cuts needing stitches, ex-wife, 2 babies born. Most people I know or knew, or never, or maybe once. Those 60 plus, yes, it gets a little more common. Again, talking about the average person in Australia here. However, if you're involved in an Australian-Filipino relationship, expect that you will soon be faced with the issue of your lady, or one of her relatives, or more of her relatives, being admitted to a Filipino hospital. Now, hospital stays for Filipinos. Doctors in the Philippines seem somehow fairly enthusiastic about sticking you in the hospital for reasons an Australian would consider a bit mild. It means expense and it means disruption. Yet it happens all the time, and I've recently been thinking about this and wondering why. I have a few theories which I'll get to as we go along. I'll just explain a few characteristics which may or may not get me into trouble with any Filipino nurses watching or reading this. Nurses in Australia. In Jeff Harvie's opinion, the absolute salt of the earth, big hearts and hard workers, highly capable and worthy of respect, wonderful human beings doing a fantastic job, instincts better than some of the doctors, dealing with miserable patients, screaming and horrible smells, etc. all day, yet keeping a smile and a sense of humour. The doctor comes and sees you for a few minutes, and the rest of the time it's the nurses that take care of you. Nurses in the Philippines, horribly underpaid, and many need to work for a year in a hospital for free. I'm serious. Yes, no salary, in order to get the work experience necessary to get their license to work. This is called a licensure. Not a whole lot of incentive to work like a saint, I can admit. However, I can almost wonder what some of these people actually do there. They sure as hell don't seem to spend much time taking care of patients. You go to the hospital without a steady rotation of relatives to actually take care of you, and I don't know what would become of you. Relatives doing the nursing. Yes, the supply and removal of bedpans, washing, feeding, mopping of fevered brows, etc. This is done by relatives who organise themselves around the clock to ensure that the patient is never left alone. They're also the ones who need to go and purchase medicine when directed, and the ones who have to remind nurses to replace IV fluid bags. Nurses may come and take temperatures and blood pressures from time to time, and that's about it. Our standards of Filipino hospitals. Largely you get what you pay for. Some are almost world class, others are fairly woeful. Something to take into account if, say, your lady is giving birth in the Philippines. Not a time to be uninvolved. Having said that, our nearest hospital is 5 minutes from our door. My grandchild was born there. See the picture of me having a little brag there. Excellent care. There's a paediatrician in the delivery room when the baby was born, and remarkably affordable. You can be fortunate. Now, reasons for being admitted to a Filipino hospital. Now, this is where I started. if your blood pressure is very high, or if you have a high fever, you may well end up in the hospital here. We've had several of our kids end up there over the years when their temperature hit 40 degrees. Although the last two times were the kids, which was a 9-year-old at the time and a 6-month-old baby at the time, I spent the first nights there unmedicated because there were no doctors there to see them, and where the nursing staff took their temperature at 4 hourly intervals. It gave them quite a blast over that, I can tell you. And next time we decided to keep the child at home. Mila and I provided better nursing care as far as I'm concerned. When I had a couple of bouts of cellulitis in my leg, I resisted the suggestions to be admitted, and I recovered quite nicely right here at home. Our relatives in the province, seems to be somebody getting admitted every couple of months for something or other. It's hard to keep up. Yes, the cynic in me realises that most of the hospitals in the Philippines are owned privately by Chinese families, it's fairly obvious that the doctors who are registered there are going to be encouraged to admit as many patients as possible. Quite the opposite to Australia, where the public hospitals don't have the space to fit kids with fevers and grandmas with hypertension. Of course they want money, they are businesses after all. Other thing, not everyone has comfortable homes and the ability to take care of sick people very well. If the house is cramped and hot and dusty and the bed is a mat on the floor, then the hospital is obviously a better alternative, and where the family may save money on medicine and get the mung healot, which is the quack healer, in to treat you with effervescent oil and some dubious advice instead. More reason to get the patient to the hospital. So, that may be a contributing factor. I don't know. And of course you can expect to whip around for money next time someone is in a Filipino hospital. No one can ever manage to pay the bill themselves. You can also expect a hospital bill to be itemised down to the pair of latex gloves and 3 cotton buds. Thank you.